Metacarpal fractures. Epidemiology. Most common site. Metacarpal neck fractures are the most common. The fifth metacarpal is the most frequently injured. Anatomy. Metacarpals, MC, have a concave palmar aspect. The first and fifth digits form the mobile borders at the carpometacarpal, CMC, articulation. The second and third digits form the stiffer central pillar. The interosseous muscles flex the metacarpophalangeal, MCP, joint and are responsible for the flexion deformity seen in metacarpal fractures. Assessment. Occupation. Assess for work-related injury patterns. Hand dominance. Consider the impact on the dominant hand. Viability. Check the circulation and tissue viability. Neurovascular status. Ensure no nerve or vascular injury. Deformity. Assess the fracture deformity. Imaging. X-ray, anteroposterior, AP, lateral, and oblique views are necessary for diagnosis. Management. 1. Conservative treatment. Splinting. The MCP joint is splinted in 70 to 90 degrees of flexion for 4 weeks in cases of non-displaced fractures. 2. Operative treatment. Indications. Angulation, translation, rotation, deformation. Translation. Displaced fractures greater than 1/2. Angulation. 210, 320, 430, 540 L, 150 degree. No rotation accepted. Multiple metacarpal fractures. Intra-articular fractures greater than 1 mm. Open fractures. Methods. Head fractures. Open reduction and internal fixation, ORIF, with screws through a dorsal incision. External fixation, used in some cases for stabilization. MCP arthroplasty or MCP joint fusion, in severe cases with joint involvement. Neck fractures, closed reduction and percutaneous pinning, CRPP, or ORIF. Shaft fractures, CRPP for non-displaced fractures. ORIF with plates and screws through a dorsal incision for displaced fractures. Acceptable deformities, based on angulation. 1. Neck angulation. 2 to 5 degrees acceptable for the second and third metacarpals. 10 to 20 degrees acceptable for the fourth metacarpal. 20 to 30 degrees acceptable for the fifth metacarpal. 2. Shaft angulation. 10 to 20 degrees acceptable for the second and third metacarpals. 30 to 40 degrees acceptable for the fourth and fifth metacarpals. And 3. Shaft shortening. 2 to 5 mm shortening is acceptable for the second and third metacarpals. 5 to 10 mm shortening is acceptable for the fourth and fifth metacarpals.